Your target ratio might be what then now, actually, if it was a 1 in 2 repeats before?
I'd say in that portfolio, I don't know that we have a target, but I suspect we are happy to see 1 in 8 to 1 in 5.
Succeed, okay, yes. What about the difference in the interaction with smaller biotech and big pharma? Do you have any where you've gone in directly with the big, or it's typically only been, if they've then licensed in stuff that came through smaller partners that you'd supported?
We realized early on that partnerships with industry were going to be a key part of our success. I mean, you can't get a drug without something moving through industry hands, and so it's by design that we're very focused on figuring out how to best work with industry. And I'd say we do this in 2 ways. One is we actually provide dollars to companies to support programs, and while the vast majority of those dollars have gone to smaller companies, we have in fact also launched PD programs at large pharma. So 2 examples of that are public would be LARC2 programs at both GSK and originally at Wyeth, now at Pfizer. So these are places where the Fox Foundation made grants to large pharma, which I know seems counterintuitive, but these were places where those programs would not have secured a foothold, and so we think of that as exceptionally high value investments for us to be making. Another way that we work with large pharma, or at least large biotechs, have been to jointly fund a common research interest. So, for instance, we've done 2 programs back-to-back with Elan Pharmaceuticals where we're both interested in providing capital at a key point of the drug development process. In this case, it was lead optimization. And so we jointly funded programs where we could put that capital out there, and we would essentially source the opportunities. And in that particular program, Elan had a right of first negotiation with any grantee that came out of that. So a very short-dated, short-windowed option, but that was the benefit to them in co-funding with us. And a second example, in this case, or similarly with EMD Serono, where we jointly funded a program focused on cognition and mood disorders in Parkinson's, a joint area of interest. So sometimes, the vast majority of the time, we are providing funds to companies to advance an effort, and sometimes we partner together. And in fact, probably now the largest example of partnering together as co-funders is in this large biomarker study that we've just launched, where we have corporate partners who are sharing the cost and working through, since there's a joint benefit for everybody, to come up with markers of progression.
And you've said in the case of larger and perhaps smaller companies as well, if you hadn't provided funding, maybe that would have withered up or just gathered dust on the shelf. Difficult to make that judgment. Could they be pulling the wool over your eyes but very happy to get the money with a program that they might have continued with anyway? How can you sort of assess that?
Well, I guess I'm not sure it matters. We get a lot of leverage when we put a grant into big pharma hands. So just going back to the Wyeth example, the PI on that grant had looked for support within Wyeth to launch that program and couldn't get it, and came to the Fox Foundation mostly because he'd come out of academia, so he was more familiar with us. A lot of companies, particularly at that day, didn't realize that they could get money from the Fox Foundation, despite the fact that we've funded companies since day one, but he came looking for a grant in an industry-only program that we run each year. And when he asked for $1 million grant, and in the review process, in our study section, we actually also have companies as part of the review process, and 2 or 3 folks around the table from other companies said, listen, he's asking for $1 million, but you're going to get this, what he says he's going to do, that's $5 million worth of value. And so that gave us the comfort. 1, the scientific idea was top-notch. We were very excited to fund it. 2, we saw that you get kind of the environmental wraparound where you get a significant extra value from the dollars that we would be providing. We were basically paying for postdocs, right? And so you get the whole environmental value. And once he received that grant, went to his boss and said, listen, the Fox Foundation's interested. They're going to give me $1 million grant. The boss got more excited about it, and it blossomed quickly into a $15 million program. So, we just look at that as win-win.
And tell us a bit about your commercial policy. Obviously, sometimes, for example, the Gates Foundation generally tries to negotiate funding so that there'll be a guaranteed low price, affordability, and so on. Do you try to put any conditions on, in the event of a successful drug ultimately coming through with your support, whether you would get any royalties, whether you would try to cap or discuss in any way the price and access policies?
Well, so far we have funded about $45 million worth of grants to over 95 companies. So that's a portion of our overall portfolio where this might be relevant. And we have not negotiated for any, we've never taken equity in a company. We don't negotiate for any IP rights. We do ask for some basic rights that are really more about relicensing a program if it gets shelved. Very modest multiples if something gets commercialized. But these are really kind of really more to maintain a seat at the table and kind of establish a partnership. We've never really tried to influence pricing down the road. I mean, our goal really, again, the way we think of use of capital is what can we do to de-risk something and to accelerate the process. And so we don't want to find ourselves negotiating over a value that's very hard to establish at an early stage or have those negotiations slow down a process. So our return is a new therapy, not necessarily a future revenue stream.
Right. So you wouldn't even expect to be getting any sort of commission, let's say, royalty if there was a successful launch?
I think a new drug is commission enough.
Yeah. And what about the relationship with the smaller biotech companies? We've heard a lot, obviously, reduction perhaps in funding by some of the big pharma of the sector, VCs and others pulling back some. Does that mean you've started to get growing appetite from biotechs that might normally have gone to, as it were, conventional sources of funding and now more open and interested in partnering with philanthropists and non-profit groups?
Certainly the shift in funding appetite on the part of VCs has increased the need for biotechs to get funding, and we are a potentially great source of funding for them and good partners, probably not just for the funds but also for the expertise. So, we have 7 PhDs on staff. We have a portfolio of 250 active grants. We see 700 grant applications a year. We really have the best catbird seat in terms of what's going on in the field, and so we can bring an extraordinary amount of expertise to that small company as well. And of course, we're non-dilutive capital, so we actually should be their first stop.
And tell us, I guess the most recent, at least public announcement has been with ALOS, is that right? Of your funding, or are there any others more recently you want to just talk a little bit about briefly?
I guess that might have been today. That might have gotten announced, and I'm not sure when it was actually finalized. But I think a couple of examples in terms of recent activities. We had a company where we made a grant in 2009 called Remind. And we made a modest grant, maybe $300,000 for preclinical work, and just recently Roche bought that program and picked up that, and so that's very exciting for us and for that program to be advancing. ADX is another example where we've recently provided funding that will enable them to continue a program and give that company some additional runway in terms of developing drugs in dyskinesia. So.
And are you finding you're getting a lot of interest from companies around the world, or is it primarily US?
We fund everywhere. We're kind of agnostic to where the best ideas are coming from, but it does happen that about a third of our dollars end up outside the US, and that's consistent whether it's an academic lab or an industry lab.
Okay. Maybe I'll just open it up. Anybody in the audience got any questions or thoughts around this?